Hi, me again. It's Tiffany. I want to talk to you today about first impressions. Um, that doesn't have to be a clinic. We make a first impression when they get to your unit. You make a first impression when they visit our cafeteria or our coffee bar, or if they're going to medical records or to talk about their bill. So, a first impression is very important. And of course, the first thing I'm going to tell you to do is welcome these people with a smile. As they enter, smile, make eye contact. Eye contact is so important to people. It establishes trust. They know that you're listening. And so the first thing that I would ask you to do as somebody comes to your unit or to your department is to smile at them, have positive body language, shoulders back, chest open, nice and relaxed, and smile and say hi and introduce yourself and welcome them. It sets the tone to your interactions going forward, and we always want to make a positive first impression. And after you introduce yourself, and you learned that in eye care, and I hope you've practiced that, to state your name, what your role is, and then this is the key for a great first impression. Explain to them the next steps, what you're going to do for them, what you're going to do with them, and sometimes what you're going to do to them. People are much more comfortable if they know what they can expect. So really practice those things. Our front office or registrars, you are the first impression for every clinic and the hospital. You are the person that greets them. They make an impression how their visit or their stay is going to go off of you. It's a lot of pressure on you, and it is one that you have to take seriously and just really kill it. You have to be pleasant, you have to smile, and you have to make good eye contact. And you always have an opportunity to connect. This carries over. You set the stage for all the rest of the people in the clinical situation, and it sets the tone, but everybody makes a first impression. You only get one time to go back into that patient's room and introduce yourself. And so do so with confidence, with great body language, and really giving off the impression that you're happy to be taking care of these people and that you're going to do your best to anticipate their needs and take good care of them. And I still encourage you, connection is my favorite thing. There's nothing like making a connection when you first meet somebody, especially for you all that work in the hospital situation and you have patients here for days, whether you be a nurse or nutritional services or EVS people and techs that are constantly going in. It is so nice for a patient that is going to be there for days and may not have family there all the time, for somebody to talk to them and just interact with them, ask them about their family, ask them what they like to do, give them an opportunity to be seen as an individual, and it's just nice. It's nice for people to have some kind of connection with somebody. I know when my mom was in the hospital, and I know you'll probably get tired of me talking about my child and my mom, but my mom was here for many months, and she made a lot of friends, and she was so excited every time EVS came in, and I know she trapped some of y'all and talked to you for what probably felt like hours, especially during COVID, but it makes a difference. It makes a difference in how these people feel when they don't feel good physically. So make great first impressions, do your best, and thanks for listening to me again today. Have a great one.